Excited, I know.
And then, yeah, we're live. Good evening, everybody. Thank you so much for joining us. It's October 4th, and our October 4th Resi Prep Postgraduate Info Series Live today is with none other than, seriously, the incomparable. I'm so excited to have her here. This is my UMES alumni um,
Yes.
partner, and I'm so proud of everything she's doing and so much more of what's coming. Dr. Jumoke, I do this every time. Dr. Jumoke Akinola, how are you? How are you? How is it going?
I'm doing great. I'm doing great. Thank you for, providing this opportunity. I'm so excited to be here. But everything's been going great ever since graduation. No complaints.
No complaints. I love it. It's the life you deserve. It's the life
Yes,
you
it's a
deserve.
good life. Yes.
So I always like to start with giving you an opportunity to just tell everybody a little bit about yourself, your journey, and where you are currently.
Okay, sure. So, good evening, everyone. I am a current first year fellow for the Rutgers Pharmaceutical Industry Fellowship. I'm currently with Janssen, which is the pharmaceutical area of Johnson and Johnson, and my current position is medical information, knowledge integration, infectious diseases, and vaccines. It's a long, long title,
Nice.
but so that's my current position. I did just graduate from the University of Maryland Eastern Shore School of Pharmacy this past May. Go Hawks. And as far as like background, I do have a bachelor's in biology with a minor in business administration.
Very good. So, Jumi, as a person who just recently graduated, take us through a little bit of what your prep process was to basically embark on this journey. And I think it's good to kind of start with, how did you figure out that this was going to be the journey and the path for you? I just remember how clear it was in your mind.
Yeah.
A lot of students are unsure, but from the moment like I met you, it was very clear in your mind that this was your path. So I'm curious if you can share a little bit about what that was like for you and how you figured it out really early that this was it for you.
Oh, great. Well, for me, you're correct. I knew before coming into pharmacy school that I wasn't, okay, I'll say it like this. I knew what I did not want to do, which I think is also a good thing if you know what you don't want to do.
Yeah.
So I knew that I didn't want to work in retail. I had worked in CVS for a bit, and I just knew retail really wasn't my thing. And, just to back up even a little bit, I've always been someone that kind of, sometimes I put all my eggs in one basket. Like that, the last round when I applied to pharmacy school, I had told myself I want to go to a 3-year institution and I wanted to be at Maryland. So I just applied to UMES and then
Yeah.
I got in, and I was like, well, if God wants it to be, then it will be. And that's kind of always been like my outlook on life and
Very
kind of
good.
why I don't really stress too much about things.
Very good.
So once I started pharmacy school and I knew, okay, I don't, not retail. I said,
Yeah.
okay, maybe try hospital. Let me see what that would look like. Institutional.
Yeah.
Like even before I started pharmacy school, I applied for a job at John Hopkins in Baltimore, so I could just kind of see what that was like.
Yeah.
And so I would go like every other weekend while I was in pharmacy school, and I quickly learned, oh, I don't know, this one maybe not also for me.
Yeah.
And I remember I want to say it was P one year. We had like a professional day, and the MSL had come in and spoken to the class. And I remember he was just discussing what he was doing, and I was thinking, like, yes,
That's
that's it.
it.
Like, I can do this. And so I remember like harassing him after his speech and just saying, okay, tell me step by step, what do I need to do, right? And he was just saying, oh, okay, IPHO, you should join that. You might want to do a fellowship. So everything he said, like a sponge, I soaked it
Yeah.
in, and I told myself from here on out, that is what I'm going to do.
Yeah.
And so because our school is small, but it's mighty, and
Yeah.
so they had some opportunities for appy rotations. So because you know how our school is structured is accelerated, I
Yeah.
couldn't do an internship during the summer.
Yeah.
So my game strategy was okay, or my game plan was when my last year when I'm on my rotations, I'll do everything industry in the beginning. So that's how I structured it. I had Eli Lilly in the beginning, I had FDA, I had Johnson and Johnson prior to applying to the fellowship. So by the time that I got to the fellowship
Strategy.
interview, I would have something to talk about, you know, because I knew I was competing against people who had internships for like 12 weeks in the summer at like BMS.
Yeah.
Oh, I've been at LA Lilly for 6 weeks. And I was just like, okay, that's fine. I'll figure it out as well. So
Yes.
that was kind of the journey.
Yeah. So it didn't just happen. You had a carefully laid out plan
Mhm.
that you followed and executed well. And this is one of like the things I always tell people. I honestly don't think that residency or fellowship it's for everybody.
Mhm.
There are people that are able to accomplish amazing things without them.
Right.
But the point is that once you come to the realization that you want to do a fellowship or that you want to do a residency, my advice isn't to just wing it, but to have a strategy and a plan that is carefully laid out and that at every juncture you execute so flawlessly that you move forward each step with more and more confidence. And so
Absolutely.
as you're describing it, first it was seeing somebody who's where you want to be
Yeah.
and then getting information from that person and then strategizing because you kind of realized and recognized that you were limited within certain aspects.
Yeah.
But there are other ways to make this up. I
Mhm.
love it.
Yeah.
So you touched on something that I think is really important that I want to talk about, right? Like 3-year accelerated programs that
Mhm.
we graduated from.
Mhm.
A lot of programs are unfamiliar with us.
Yes, they are.
You don't necessarily know what it takes.
They
And
don't.
they don't know what it takes. And when you're from a program like ours, where the expectations were above just meeting expectations, like the performance standards are so high with the pass
Absolutely.
set at 85%. I'm really curious about what your strategy was when you went on these interviews
Mm.
about how you would articulate some of these things and skill set that the program they really gift us with.
Yeah. Yeah.
this, this gift we don't know that we are having, but it's a gift of resilience and multitasking and the
Mhm.
ability to just get it done.
Yeah.
So I'm curious about like when you were preparing for your interviews, what are some things that you kind of had lined up like these are going to be my key points that I just make sure I hit on?
Yeah, absolutely. So it's funny that you said that because anytime that the question, because this question always came up, how are you able to handle like multiple things at once? And
Yeah.
my response is always, oh, I went to University of Maryland Eastern Shore. I went to a 3-year accelerated program. I've mastered multitasking because of this program. This program, you can have like 10 assignments due within the week and like an exam on Friday, and you still have to go, you know, mind you, I also worked every other weekend. So like
Yeah.
also balancing that. And so for me, it was always just, okay, when that question comes up, I'm just going to always talk about Eastern Shore. Like that was literally it. I went to a 3-year program,
Yeah.
like something that was meant to take 4 years, literally 4 years. They somehow smushed it into 3. And so for me, it was just like, obviously, of course, I have to play this thing up, like that
Yes.
aspect of it. And I also, like you said, because our program required like an 85% cutoff, I had to really like, I emphasized the fact that excellence is promoted at my school. No one is, mind you, technically, all of us are above a 3.0 because of the 85%, you
Oh,
know,
we
cutoff,
are.
you
Oh,
know? So
we
I
are.
always would, you know, emphasize like I've been taught to be excellent because of the school that I come from. So
Yep.
it's like a no-brainer for me. And so
Yeah.
I would always articulate that within interviews, and I would always hound,
Yeah.
let them know, like get that point out. You
Get
used to
that.
say it like it's like a humble brag. So
It
like,
is. I know.
I wouldn't, it's a way, it's an art, it's a skill form.
Mhm.
It's a talent to be able to just say, look, I've done these things,
Yeah.
and these things will be able to be transferred into this position. And
Yeah.
here's how. This is how I've been taught it.
Haven't taught it.
Yeah.
Such great pointers. And I hope anybody who's watching this back is really listening to what Jumi's saying here, because it's not, what is it? It's not arrogance
Mm.
when you can point to case in point on your CV. You can point to the fact that you worked concurrently while meeting and exceeding expectations at a 3-year program. This is what you did. Like, I am stating what I have done.
Yeah.
And so every time I'm working with people, I'm just kind of like, I need you to take more ownership of these things
Yeah.
like you did them. And so stating what you've done, there's nothing arrogant about that, because being overly modest when you're competing at such a level can in fact hurt you.
Yes.
And so
Absolutely.
I think that some of the students really do struggle with striking that balance of speaking about what they've done, the things that they've overcome, and this moment that they're in. Like, you're interviewing for your dream position as a postgraduate candidate. So the nerves are normal, but also like, sis,
Yeah.
draw from what you've
Yeah.
done.
Draw. Yeah. Yeah.
From what you've done and come into this thing, letting them know, like, look at this. Here are specific examples of times when I've been able to do 1, 2, 3, and 4. And here's how those skills will immediately translate into the next role and my position here. So I love that you're talking about that. So I'm asking everybody this question for the P1 and the P2 who's tuned in, not necessarily the folks that are in the trenches right now
Yeah.
applying, but for the P1 and the P2s, this could be their first or second time hearing from someone in a fellowship. Uh, Describe a little bit about your position and what your fellowship is broken up as, like what this first and the second year will kind of be like.
Okay, sure. So, um, for the P1 and the P2 that's currently watching, my advice to you, or like, okay, I'll just start with what I do currently within my position.
Yeah.
So within, like I stated before, I'm medical information, knowledge integration, infectious diseases, and vaccines. So my fellowship is broken up into about 3 parts. For 6 months, I'm in the Drug Information Center at Robert Johnson Hospital. And then for a year, I'm back with Janssen, and I'll be working with, more of the pharmaceutical company. And then for another 6 months, I could possibly also be in the call center there as well. So for the 6 months when I'm at the Drug Information Center, that more closely mirrors what I've learned in pharmacy school. So I help with creating drug monographs for the P&T committee. I've been able to present about my drug at the P&T committee. It was also approved to be put on formulary. I also, if there's any questions that come into the DI Center, me and the residents and our students as well, I help. We do like extensive literature searches on PubMed, Ovid, and then we just answer those questions for healthcare professionals, or if it's a patient, just call in with a question. You also have endless opportunities. I'm currently working on a poster for mid-year, and I also will be creating a CE course, and that's really exciting because I've never done that before. So that's always something new. And so after that, then I'll go to Janssen and then continue on with the rest of my fellowship. But as of right now, I'm in the Drug Information Center. And could you also remind me what was the first part of your question again?
Yeah. Yeah. The first part essentially is what your year is broken up as.
Mm.
That's what you've kind of covered. And then the second part is just your title, your position as the fellow. You were saying it's a long title, like drug information, infectious diseases, vaccines.
Yeah.
But that title, what would that title translate into? Like once you complete, like what are potential opportunities for somebody who completes your fellowship?
Okay, yeah, that's a great question. Okay, so for the med info knowledge integration position that I'm within right now, it honestly can translate into like anything because you make your fellowship what you want it to be. If you know, okay, you're there and you're like, I want to try commercial. You can go ask your preceptor, can I have work with the commercial team for like, say, maybe a month, 3 weeks, you make of it what you will, and
Yeah.
then you see, okay, I like this. Maybe I want to veer more towards that. Or maybe you're like, oh, okay, I'm looking more into regulatory affairs. I kind of have an interest there. Then you can go do a project there. So this position, or any position, honestly, can translate into whatever you want to translate it into. The
Absolutely.
fellowship is only what you will make it. If you don't want to do too much during your fellowship, then you don't have to, because at the end of the day, everyone is a professional. You've graduated pharmacy school. You will make the career decisions that you want to make. And if you have high goals for yourself, then you will do, the things that are necessary so you can create the kind of career that you want. So for me, I'm looking at it like, I can have whatever I want after I graduate, once the fellowship is done,
Yeah.
because I know that I'm doing certain things, I'm putting things into place so that I have as many skills, or acquire as many skills as needed for
Absolutely.
whatever position that I want to apply for after I'm done.
Very good. That must be exciting. Like just going through your training and feeling like when this is over, the world could literally be my playground.
Yeah,
I can pursue my passion and really do something that could bring me true joy and be
yeah,
meaningful.
yeah,
I think that's so cool and that's really, really profound because many people literally spend their lifetime looking for that power.
yeah.
I talk about that power a lot and I tell people I'm pro postgraduate training because of the freedom and the power it puts in your hand
Mm,
about what you do next.
mm,
You get to learn, you get to grow, you learn how to integrate, you learn how to function effectively as a team member. There are all these things that it gifts you.
right.
I genuinely believe that at the top of that list, it's the power
Mm,
and the freedom for
yeah,
you to sit down and literally take self inventory and say, that's it, that's what I'm going to go after. And you have the skill set and the confidence to hunt
I
that
think so. Yeah.
down. That's really, really cool. Um, you know this. One of the things that I'm super passionate about is just sharing
Mm,
for others that are coming after you. I think like the journey, your destination is important.
yeah.
Where you start is so important because it's this reference place that you'll always have. But there are things we pick up along the way during the journey. And I'm asking everybody, what are some wisdom points? Like, what is your wisdom from the journey that you have that you'd like to pass on to the people in the trenches right now?
Okay. I feel like, oh man, there's so many points. Do I
Yeah.
have time? Do I have time? I would say if you can find about 3 to 4, maybe even 3 to 5 people that you can put on your team,
Yeah.
so that you can come to them with whatever you need to ask,
Yeah.
find that as soon as possible, like as quickly as possible.
Mhm.
And the best way I would say for you to find that is to attend different meetings.
Yeah.
And when you go to those meetings, find someone that you resonate with.
Yeah.
Like, if I go to this particular event, or they have this meeting, and I remember there would be like someone talking, I would tell myself, let me go ahead and add her on LinkedIn. And I either her or him, whoever,
Yeah.
add them on LinkedIn and send them a message. I really enjoyed your talk during this discussion today. Please, can we meet? Let's
Yeah.
have a one-on-one. And I would have those one-on-ones. And during my fellowship process, like the application process, there would be about 3 people that I would go to. You were included, and it would be three people that I would always come to, and I would say, "All right, I have a second interview. What should I say?"
Yeah.
And for me, I'm someone that you can tell me, like, as long as you tell me and show me, I got it.
Yeah.
I would say, what would you say, Dr. Traore? And then you would say, I'd be like, oh, let me just write that down.
Put that down. That was
And I would write that
so
exactly,
good.
because, if I admire how you speak. I think you're very eloquent,
Oh,
right? So
thank
for
you.
me, I would write down how you would say something, and then I would sit back and say, now how can I make it sound like Jumi is saying this?
Yeah.
And so when I would do that with you, and with like a lady named Pauline, and another lady named Kiana, and I would just write down. I would see all of your points and say, "Make this Jumi," and like, so that So that when the interview would come, it would still feel natural. But I knew I was hitting the points that they wanted and
Yeah.
what they were looking for, because the difficulty, especially for someone that's at UMES, I'm talking to those in the trenches, we aren't necessarily taught how to speak industry because
Yeah.
there's a lingo. It's not clinical, it's not retail. There's a lingo. There's a very specific lingo to being in industry. And unless you hear it and it's reinforced, it's very hard to like catch on.
Yeah.
So I don't want those coming after me to like now get to their last year and feel intimidated by other students that they're meeting that are saying things like, oh yeah, high level or whatever, all these buzzwords. I spearheaded, I created, I managed,
I managed. Yeah.
Oh, okay, great. Because for me, I would have been like, yeah, I did so and so at this rotation.
Yeah.
It's very basic language. It's very baseline.
Passive versus active. Like I talk about
passive
so much.
Yeah.
I tell them like I'm reviewing CV and it's like I led and I'm like, no, you spearheaded.
Yeah, you spearheaded. Yes.
Go ahead and put that in there.
Yeah. No, honestly, what you're saying is correct. And I also feel like sometimes it's like a cultural thing. It could be cultural. Also, our school is also an HBCU. It could also, it's like these different elements that you have to cut through.
Yeah.
To really show your true potential, because we have great candidates.
Absolutely.
Absolutely the best. They can compete with anybody else in the US, but they don't know how to speak to those accomplishments or speak to themselves. They're just very shy, a little bit more unique, and
very humble.
Very humble. And it's wonderful. It's great to be humble, but you have to also be able to speak to yourself. You're doing yourself a disservice. You're doing the school a disservice. You're doing your family a disservice. They've put all this time and effort into you. You need to showcase that, And so I would say that's definitely like the overarching thing, or my overarching wisdom is just be able to be confident in yourself and not feel like you're bragging. You're not.
No.
You're not. Trust me. You'll see bragging. You will definitely see it. You're not bragging. You're speaking to to what you've done. And as long as you find the right people around you to do so, like you're good to go.
Yeah. I always just thought you were so funny. Every time I talk to Jumi, hold on, let me go ahead and write that down.
Yeah.
Say anything, Jumi. It's like, wait, can you say that again? Hold on.
Yes.
And I always just thought it was so funny. But one of the things I absolutely admired about meeting you and getting to know you and like watching your entire journey, it's like you were really, really in it to learn how to get where you're going, because it wasn't a question about whether or not you could cut it once you were there. It wasn't a question about whether or not you had the accomplishments to speak to why you were qualified to be there. But I think you recognized very early that there could be a challenge in how you presented and articulated all of these wonderful and amazing things that you've done.
Absolutely.
And it's like there was no insecurity about this, because for you, it was just, I can fix this. I just need to connect with
No, I was like, oh, I can fix that. Yeah, that's no problem.
And I think like that's such an amazing life skill to have, because it's one thing to be super smart and then just feel like you're the smartest person everywhere. But I always tell students that if you're intelligent, highly intelligent, and you stay curious, people around you are always going to look to invest in you and want to help. And because you're constantly coming from a space of, ooh, well, what's that? So they're always willing to take your knowledge to the next level. And that's what you want. But when your energy is that I got it, I know it, I'm good. They'll leave you right where you are.
And they should leave you right where you are, because you actually don't know anything. And then you will never hear me say, oh, I know this, because I probably don't. Like I need the help. And I'm not afraid. I'm not afraid to ask questions. When I was in class, I know people would get annoyed with me, because I always be like, I'm sorry, can you say that again? I didn't quite understand, So, but I always felt as though everyone else around me also didn't understand. And there was no way it was just me. But people didn't, I don't know, maybe didn't want to seem as if they didn't get it in
Yeah.
front of others, but I don't really mind. You know,
Nope.
there's no such thing as a stupid question. If
Nope.
I don't know, then I don't know.
Yep.
So,
You know, I'm over here stomping my foot like, yes, hallelujah. I'm with all this.
mm,
This is amazing. I wanted to know if you could tell everybody where you guys are in the application process. Is it
okay.
open? When does it close?
Mhm.
And of course, are you open to people, doing what you did, sending you LinkedIn messages?
Oh yeah. Oh yeah. Okay. So sure. So for the application process right now, the deadline actually is tomorrow.
Ooh,
So if you,
get
I'm
it in.
hoping that you can still get it in. If you have the things there, I will not discourage you. Definitely go ahead and throw your hat in the ring and try it.
Let's go.
And I'm only speaking for records, mind you. So
Yeah,
the deadline is tomorrow, and then interviews will start, I believe, after the 10th, and then
awesome.
you should be hearing back from the different companies, and then throughout the month of October, November. Interviews will be taking place. And then in December, we'll be conducting final round interviews at mid-year in Las Vegas. I should see you all there.
I shall see you.
And I know, and I'll see you there. Stop by my poster. And so that's definitely what the recruiting season looks like currently.
Awesome.
And from what I've been able to see, we do have a lot of strong applicants. So I'm really, really excited for this year
Very
and
good.
the new crop of candidates that we'll have for next year.
Yeah.
And so that's really, really exciting. And
Yeah.
then, of course, you can definitely hit me up in my inbox on LinkedIn. I really tried to pay it forward because I know how much I really leaned on those that answered me when I sent them one-on-ones, and so I don't want to leave anyone behind. So hopefully, like, if you don't, I kind of respond pretty quickly, but then if you ask me to review something, give me like a week or two. I'm still like juggling other things as well, other
Absolutely.
people that I'm helping, but I'm always, 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 always willing to help.
Thank you so much, Jumi. So, like, bottom line is reach out, but also be mindful that, yeah, she has a job to do.
Yeah,
So,
I kind of got a
yeah, she has a
job.
job. Happy to help, but please give her some time to step in and help. I'm so grateful for this opportunity. Thank you so much. And like I said, I'm rooting for you, but you know that.
I know.
But you
And
know
thank you
that.
so much, Dr. Troy. And I still can't call you by your first name.
I don't
It's a
understand
struggle.
why not. I don't
I don't
understand.
know. I don't know. Maybe one day.
See you in Vegas, and I will stop by your poster with a gang of questions for you. You
Yes,
already know.
thank you. Yeah, I'm so
All
excited.
right. Have a great evening, Jimmy. Thanks so much for this. Thank
You
you.
too. Yep. Thank you so much for the opportunity.
Absolutely. Bye bye.